Hello, good afternoon, good evening, or good morning from Geneva, headquarters of the World Health Organization. Every Wednesday with you are our Dr. Mike Ryan and Dr. Maria Van Kerkhove answering your questions about COVID-19. My name is Alexandra Kuzmanovic from the Department of Communications, and I would invite all our viewers watching us on Twitter to use the hashtag AskWHO while asking questions. If you're watching us on Facebook, YouTube, or LinkedIn, please leave your comments, questions via comment section. Good afternoon, Maria, Mike, how are you?
Hi, Alex.
Thank you for finding the time this week again to answer the questions from our viewers, especially as we are marking this painful moment this week where we passed 1 million lives lost directly to COVID-19 and millions others suffering either being affected by the virus or for other health services being disrupted. However, how do you see the way forward and how we can improve things?
Well, Alex, thanks for having us again. And I think indeed we're at a really tragic milestone right now of at least 1 million deaths due to COVID-19. And these are deaths that have occurred over the last 9 months. From a new virus that has entered the human population, spread across the globe. And I think we need to take some pause and actually reflect on this. It's not just a number. These are 1 million lives lost. These are families. These are mothers and fathers and children and friends and loved ones. And I think all of us know people who are either directly or indirectly affected by this pandemic. All of our lives are affected by this, but I'm sure all of us know someone, who has lost a loved one or has lost someone themselves. So I think we are grieving together. I was trying to think about what this 1 million actually means. And I grew up in the US, and all of us have grown up with sporting events, and I think of football matches in the US or soccer matches and European football in Europe, and those stadiums are huge. And they can fit 80,000 to 100,000 people. And if you think of 10 football stadiums full of people who've passed away, it's really sobering and it's humbling. And I think we just really need to make this push us even harder to work, to continue to work to prevent infections and save lives. And for me, there's so much that we can do. You hear Mike and I speak a lot, and the Director General speak a lot about all of the things that we can do now. And this just makes us work even harder. So, there is hope, and there continues to be hope because we continue to see countries work incredibly hard to bring outbreaks under control, for earlier clinical care for patients and save lives. So this is a tragic milestone, and it's not just another number. It's a really important thing that drives us, makes us work even harder.
Thank you, Maria. Any thoughts from you, Mike, on the way forward?
Yeah, it's interesting, that million number, because it's a very resonant number as an Irish person, because the greatest tragedy in the history of our nation was the Great Famine of the 1840s, 1850s in Ireland, and it tore our country asunder, ripped our culture apart, caused the further departure of 2, 3, 4 million other people, and that's why you see the Irish diaspora about that one event that killed 1 million people. So it's interesting to me that the 1 million for the world is horrific, and that 1 million that died in my country changed the course of our country's history forever. It entirely reshaped Ireland and a good part of the rest of the world through the influence the Irish had after. So good and bad came from that, some horrific things and some good things. And in that sense, we, I suppose, have choices now. We've suffered this great loss, as Maria has said, and you can't compare this. Some people are comparing this to other things and saying, well, 1 million people died of something else. You can't compare this to anything else. 1 million people have died and their families are grieving, and this has disrupted and changed forever the lives of so many. But mixed with that, and must be tinged with determination and hope that we can avoid the next million, or we can prevent more deaths in the coming months. And there's a lot of work to do. So for me, it's tremendously sad, but it's also a call to action. do we need to stand by and let another million people die? Or are we going to do something about that? And what can we do? And what is possible? And it is the art of the possible now for us. But it is difficult, as I think we'll maybe just speak about this later. I think people are generally finding it very hard to sustain the effort to maintain and sustain all of this effort in terms of trying to avoid infection and trying to do the right thing. So I think that's a moment of reflection for us all, is to recommit ourselves to fighting this virus and in honor of those who have died, but also to protect those who may die in the coming months.
Thank you both. Maybe this is a moment as well to reflect on what we have learned in past 9 months, while we lost some people, unfortunately, but also while we treated many people and while we also prevented many people from getting sick.
Yeah, I mean, in the last 9 months, in terms of our advancement in science and our understanding of this virus is pretty remarkable, in the sense that the entire global community has come together to better understand what this virus is, how it transmits, the disease and diseases that it causes in people, and what we can do to prevent the virus from spreading, what we can do to prevent people from getting infected, from developing severe disease, and from dying. And so this collective drive across academics, public health professionals, frontline workers, people in different ministries and different countries all over the world have really come together to push the boundaries of what can be done in a 24-hour day. There are so many people that have been working, incredible hours, because we all have a common goal, is to understand this and to end it. But in terms of advancements on, we know that there are things that can break chains of transmission. We know how the virus spreads between people, and the steps that are necessary to protect people. The advancements on clinical care, making sure that people are detected earlier, that they enter the clinical care pathway, they are triaged, assessed and triaged, making sure that there's a clinical assessment to know what is needed for this patient. Early access to oxygen, early access, to symptomatic care, and for severe patients and critical patients, having dexamethasone. I mean, all of these actions save lives. And so it's that knowledge that has been used to make guidance. It's that knowledge that has been used to create trainings. It's that knowledge that has been used to say what is the right personal protective equipment that needs to be purchased and procured and shipped. And it's WHO and our partners who have helped us to realize the use of science. Having science in a paper, having science on a piece of paper is one thing, but really what we try to do with our partners is to turn the science into action, because that's what saves lives. So there's been a tremendous amount that's been learned in the last 9 months, and we continue to learn. So it doesn't end. The science doesn't finish. And there's a lot of research questions that have been identified and prioritized, but those research questions will be answered, and then more questions will come up. So we continue to work, and that's the process that is science.
Yeah, I think, and I really second what Maria said, and I think while we may be all frustrated and all of us want to know more, in the past it's taken decades, years, months at the very least, to have even a basic understanding of some diseases that have affected us. It took us years to understand HIV and AIDS. It took us years to work out what was causing AIDS. It took us decades to work out what the hell was going on with Ebola, where was it coming from, what was causing it. And we did better with SARS and MERS, but it still took significant time. We have never, in the history of science, ever understood more about a virus and its interaction with human beings in such a short time, and developed so many ways to counter the virus, and so many mechanisms and methods, and now therapeutics and potentially vaccines and diagnostics and all of that. So we have to celebrate that as something we've learned. But I think we've also learned that science doesn't work without community. You can have all the technology and all of the solutions that you like, and I think it's the same with all technology. if people don't use it, and if people don't believe in it, and if people don't put it to good use, then it doesn't do anything. Technology and knowledge by itself has no inherent value unless it is put to use. And that is what we've all struggled to do. We've all struggled, governments have struggled to put that knowledge to the best use. Communities have struggled to fully understand and internalise what that means for them and their individual and community behaviour. So I think that's where we're learning too, that just the conversion of knowledge and science into effective action is not a straight line. And we need to respect that and need to understand better how better to communicate with people on what protects and what protects their health. But in more general, what have I learned? And I suppose these are the principles that guide any endeavour in human society, be it as we face climate change, or we face social injustice, or we face racism, or we face that our planet as we face. What are the things that I've learned in this event that are applicable to other things for us as a society, as a community? Unity, empathy, solidarity, empathy, resilience, commitment, staying power, staying focused when you're being distracted from all sides. It's those simple qualities of human endeavour and human effort that are hardest to sustain at a time like that. So yes, we learn the very specific sciencey things. Yes, that's great. Sciencey stuff is good. But we're also learning more fundamentally about how our societies operate, and how we need to do better at getting information and knowledge to our citizens, and how that trust that should and must exist between government and science and communities is a really important triangle. And I think it's one we've taken for granted for too long, and we need to do better. So I've learned that.
I think one of the challenges with this too is the duration of this event, and having this trust with communities and with people, and to maintain that over time as the situation changes is really very difficult. People are getting frustrated, and rightly so. I mean, we understand that ourselves, and how we're dealing with this, but maintaining the momentum is something we need. It's something we have to earn, from people, because just telling somebody what to do is not the same as, why is this important? What does this mean for you? And how can we how can we support you in doing this? Or how can we work with you to make it fit for your family, for your community, for your safety? And that's a challenge, and that's a very difficult thing to do, and that requires individuals and families and religious groups and leadership, everything. But the maintenance of this trust is very, very challenging. We take that very seriously. We try to communicate consistently, of what needs to be done. But communication of these complex measures are very difficult. We find often that people would like us to give a yes or a no, or a do this or don't do that. And a lot of the time when we give advice, it's contextualized. It's, well, in this type of situation, you can do this or this or this, or this and this and this. And that doesn't make it a very short and concise message. But it is complex. All of this is incredibly complex. Otherwise, it would have been sorted, very, very quickly. But people are very smart. Mike has said this a lot. People are smart. They need knowledge and information for action. But again, we will work harder and continue to work with different groups. You've heard us talk a lot about youth groups, because so many different groups can play a role in this. But I do hope that everybody feels a sense of empowerment, that there are things that they can do themselves to protect themselves and protect their families.
Thank you very much. We are receiving already a lot of questions from our viewers, and we thank them, and please keep them coming. Maria, you're you're an expert in infectious diseases and epidemiology, and I know you spoke about this a lot, but maybe it would be good to explain again. Are we going through a second wave of COVID-19 infections, or we're still in the first big one that is having different peaks?
So if we look at the world, it's very difficult to give a short answer to what's happening across the world. The virus is still circulating. We understand that about 10% of people have been exposed to this and have some evidence of infection. That means 90% haven't. And that means that the virus will continue to circulate if we allow it to. So many countries have experienced a peak, at least one peak so far. Some countries have avoided a first peak altogether. But in some areas that have gotten through their first peak and brought it under control, some are starting to see a resurgence or an increase in case numbers. And usually when we say wave, we think of a seasonal virus like influenza, where they have real seasons and they increase in the winter months in the northern hemisphere and southern hemisphere. We don't see a seasonality in this virus yet. This virus circulates in all types of settings and climates and regions. And what we are learning is that with the activities and the actions and interventions that are put in place, it could bring those peaks down and it can bring the virus under control. And in some countries, the circulation has started.
And eventually, in most cases, the immune system wins. We fight off the virus. It doesn't do too much damage. You may feel sick, the lining of you may feel a cough, you may have a sore chest, you may sneeze, because it's really disrupting the function of your respiratory system, but most of us get through that. What happens in some cases is that people's immune systems are compromised for some reason. They're not functioning as well, and their bodies don't react quickly enough, and the virus takes control before the body's system can react. And that's particularly worrying if it gets lower down in the lungs, because that's where you get your oxygen to your blood. And what can happen is it causes a swelling of the lining of the lungs, and that swelling can also